Hi, last week we talked about chest tube drainage systems and we talked about the parts, we talked about the types. This week, let's cover nursing responsibilities and how to set it up. We will have another video because there's more to say. In that video, we'll talk about troubleshooting the chest tube drainage system. Let's go into it. Last week I mentioned that the dry suction has advantage over the wet suction, so I'm going to quickly run through these advantages before we go into the setup. So the dry suction is easier. The dry suction unit or the dry unit is easier to set up than the wet one, and it is less noisy. It is less noisy because unlike the wet one that has continuous the water now is like something like continuous boiling, let me put it that way. So that noise, it increases to the noise of the wet suction. Then the dry suction, you don't need to put water in the suction area, but for the wet one you have to put water because it's the height of the water now that controls the suction, and with use that water can evaporate, and as it evaporates you need to replace it. So that makes it a lot harder than the dry suction, where you don't have that problem of replacing the water in the suction unit. Then another thing is that if the wet suction tips over, maybe accidentally, the system and the patient are compromised. But for the dry suction, there is less problem if it tips over. Now let's go over the setup. For the setup, let me use this. I will use the dry suction mostly because it has more advantage and that's what you use more often. So for setup, this air leak chamber right here, which is in the water seal chamber, this air leak monitor right here, this area is in the water seal chamber. So there is a sterile water, about 45 ml of sterile water that comes with this pack. So when you get the pack, you open it, sterile procedure. Open it, take out the sterile water and put it. There's a pot up here. When you put it inside, once you put it inside, it turns blue like this. Before you put it, it's white this way. When you put it, it turns blue, and that is just like to highlight the place, so your eyes should always be on this place, okay? Because that's what tells you what is going on in your chest tube, unit system. Then there is a ball, something that looks like a ball here. It's called the pressure float ball. It goes up and down, up and down. So you will see the ball when you pour the water in and then when you set it up, as the patient breathes, it will be moving up and down. So pour the water in and then put it on the ground. Use this to stabilize it. If you don't want to put it on the ground, there are hooks up here you can put it on. Hook it onto the bed, but just make sure it's below the patient's chest. So when you do that, then you take this tubing right here, the end of this tubing right here, and attach it to the chest tube coming out of the patient. Then you secure it with tape because you don't want any form of leaking between the two connections. So when you do that, then if there is an order to attach it to suction, there is a place here that says to suction. So you take the suction tubing, attach it here. Then you take the other end of the suction tubing, attach it to the wall suction, and turn it on to at least minus 80 millimeter in mercury. So when you do that, you are ready to go. That is for the dry suction. But for the wet suction, you still have to put water. This is the wet suction right here, okay? And this right here is the suction chamber. So you have to put sterile water. Apart from the sterile water you put in the air leak monitor, you still have to put sterile water here up to the 20 centimeter mark, which is the height of the suction, and that's what controls the suction in the wet suction. And every other thing apart from this water you put here, every other thing setup wise is the same with the wet suction. So that's how to set it up. Now let's go over the nursing responsibilities. We'll go over a chamber by chamber so that it's more organized. So the first thing you do, this one is clear, let's use this one. The first thing you check for, your eye should be all over this thing and the tubing and the patients and the chest tube site. So for here in the drainage chamber, you keep an eye on the drainage. What is draining there? Is it blood? Is it fluid? What's the color of the fluid? How much is draining there? If it drains too much, like 100 ml per hour for 2 hours, is too much, you call the attention of the doctor. If it suddenly stops, you call the attention of the doctor. So those are indications that a problem might be happening somewhere. So that's for the drainage chamber. That's what you look out for. Now again, another thing with the drainage chamber is if it tips over, the way you know that, because somebody can hit it and bring it back up to stand, for you to know that something has gone wrong, you will see that there is fluid here, there is fluid here, and there is fluid here. That tells you something is wrong, because fluid is supposed to fill up this place, then come up here, then fill up this place. But if you see fluid in all 3 places, that means somebody has kicked it and you should change this unit. And when you are changing the unit, you don't need to change with the tube. You just disconnect it with the tube here and put another unit. We'll talk about that at a later time. So that's all with this side of the chamber. That's the collecting chamber. That's what your eyes should be on, and that's what you should do. Now for the water seal, your eye should be on the monitor, the air leak monitor. The air leak monitor has numbers 1 to 5. The more the bubbles you see in it, if it's at 1, that means there's less bubble. If it goes up to 5, there's too much bubble. So that tells you there's a problem. Call the attention of the doctor or the provider, whoever is managing the thing. Then there is a ball here that goes up and down. That's the floating ball. It's an indication that of respiration. If it goes up, with inspiration it goes up, with expiration it goes down. That's for patients who are breathing on their own normally. But patients on the ventilator, because you know the ventilator uses positive pressure, that it is the opposite direction. So with inspiration it goes down, then with expiration it goes up. So just ensure it's going up and down, meaning that your patient is breathing. And then keep your eye on this place. At the beginning, when you start draining, when they set up the chest tube and the unit, there should be some kind of activity of air leak here. There should be some bubbling here. Not continuous, just intermittent bubbling. If it is continuous, there is a problem, and it is too much all the way to 5 continuously, there's a problem. You should call the attention of the doctor. But if initially you have intermittent bubbling here, there is no problem with that. Then we'll talk more on that. Then the next thing you see is the air leak, the suction chamber. So the suction chamber, for this one that is dry, there is a knob here, you can control it. It is at 20. It comes at 20. When you open it, it is set at 20 because that's the most common number they use. And then when you connect it to suction, this bellow right here, this orange area will expand. When it expands, that tells you that suction is in the unit. If it does not, know that there is a problem. And then there is an arrow here that indicates that when this bellow increases, expands and gets to the arrow, is at 20. When it goes more than that, it's more than 20. So you make sure that this is expanded, because that's what indicates there's suction. Then moving on to the tubings, Make sure that there's no independent tubing. That's the tubing is coiled around itself, or it's hanging. It's not, it's hanging, it's not going straight. The drainage is sitting within the loops of the tubing. That is not okay. Make sure you straighten it in such a way that the fluid follows the path and goes down into the chest tube. So that's what is independent loops. And there shouldn't be kinks too. Then on the chest tube side now, where the tube coming out of the patient, you should check the area that is covered with dressing. So, but you should check it from time to time for signs of infection, redness, swelling, pain, discharge. Then another thing is you should palpate around it to make sure there is no air under the skin, which is subcutaneous emphysema. So those are your assessments that you will do. Check all those chambers, all of them. Make sure that everything. For the suction, there is always continuous bubbling in the suction. You know, this one should be intermittent. But for the suction, there's continuous bubbling because, you know, it's suctioning constantly. So when with continuous bubbling in the suction, it's normal. That's not an issue. If you don't hear continuous bubbling in the suction, that means it's not suctioning. So that's an issue. So those are the things you should look out for. Thanks for listening. Make sure to like, share, subscribe, and follow for more. See you next week for the rest of the video.